if you're like me, you're utterly confused by our healthcare system. You're probably utterly confused as why our government is shut down. And that confusion prompted me to bring on our guest today because he is an expert in untangling our gigantic, complicated healthcare system. He has been at this movement for much longer than I have. I first found you, Dutch, on LinkedIn before the pandemic when I was trying to figure
That's right.
out how to start a direct specialty care clinic. So 6 months before the pandemic started, I opened my own clinic and I decided I was going third party free, that I was not going to contract with insurance companies, the government, or hospitals, and the only people are going to work for are patients. And so I did my research primarily on LinkedIn. Now I'm not really allowed on LinkedIn, so I don't go there very much. But Dutch caught my eye early on, and he's very outspoken. He's very knowledgeable on how we can fix our healthcare system. He has his own podcast. I believe it's called The Doctor's Lounge. Is that right, Dutch?
Yes.
Are you, okay, yeah. And
Can you
he has
hear me?
written a book. I can hear you, yeah.
Okay, good.
Okay, so he has a book. I believe your book is called Too Big to Care.
Yep.
And one of my, I have been clashing with hospitals, and I think we have a common bond in that we think this whole nonprofit business of hospitals is complete BS. Can you elaborate on that?
Well, thanks for having me on your show. I admire you greatly. Lots of respect for you. I do remember meeting and we talked about ENT prices. And I remember because my little girl was having her adenoids out. And then I remember like looking at a bunch of different physicians and saying like, well, where can I go around the country? We were living in New York full time at the time. And I was like, where can I go? Like, this is insane. I don't want to go to NYU Langone. I don't want to go to Columbia. There's nowhere else to go. What can I do? And I remember, I don't know if you and I talked or you talked with my partner, Bud Brooks, who's in Dallas. But anyways, I remember becoming a big admirer and then watching your X account just explode once the pandemic went crazy because you were trying to defend patients. And so, no, great to talk in person. And yeah, we do have the problems are real and the challenges are real. I would say I don't think they're overly complex. I think we've allowed lots of nonprofit health system fancy people to kind of muckety up the whole thing. But it is pretty straightforward, and hopefully we can have a good conversation around it. Yeah, it's going to be great.
Yeah, I'm thrilled to have you on. And let's start with, let's start with the government shutdown. And they seem to
Yeah.
be fighting over ACA. Can you tell us sort of what is ACA to begin with, and why are they fighting over it?
Well, look, the Affordable Care Act was written much to put single payer on the board, right? Hillary Care was going to do single payer. The Heritage Foundation wanted some type of catastrophic care in the late 90s, early 2000s. When you look at what the government has wanted to do, and I think it's largely run by big industry. I don't think I wear a tinfoil hat. I don't think, there's some master planner up at the top saying, well, we're going to make this happen. But I think it's always been the overwhelming strategy. Like, how do we control 20% of the GDP? And so the Affordable Care Act did a couple things. One, it was a psychological masterclass in how to manipulate people and how to get them to do what you want. I mean, if you think about it, I was in New York City as a young accountant paying $188 for my catastrophic insurance. I still have my bill. I brought it out on a podcast the other day. And I paid $188 a month and I had a $10,000 deductible, but I was 23 years old working at an accounting firm. Like, what else did I need? I'm like, if I get in an emergency situation, like what else could I possibly need? Like, then I have to pay for something. But other than that, I'm a healthy young guy. Well, so of course we can go through the lies, which are, if you like your doctor, you can keep your doctor. We know that's not true. If you like your plane, you can keep your plane. That's the one I had the biggest challenge with. And then, they'll say things like, I hear this all the time, and I really do try to educate people, and it always turns into a political battle, which I don't want, right? I want it to be about healthcare. They'll say things like, well, Dutch, we had all these people that had pre-existing conditions, and, the ACA fixed that. And I'm like, okay, well, then let's have a real conversation about that. How about you and I have a conversation about, did workers' comp cover pre-existing conditions? Well, Dutch, what's workers' comp? Like, people don't know. So we're already like kind of learning. And then people say, well, I'll say, well, what about Medicare? Did Medicare cover pre-existing conditions? Well, yeah. Okay, well, that's 68 million people, man. Well, what about Medicaid? Does it cover? Well, yeah, it covers. Okay. Well, how about large companies that had self-funded health plans? At the time, there were 70 million. Today, there's 105 million represented by. So I'm like, okay, look, we're at 200 plus million people. What do we have left? How about the military? TRICARE and Champus. I'm a Marine Corps vet. Like, I'm covered by pre-existing conditions. Like, I can't. So when we get down to it, it was like 8 million people were not covered by pre-existing conditions. Well, what else could we have done with that? People like me went to Washington and said, well, here are the solutions. And we offered them. And the bureaucrats, as normal, were like, we don't want to do that, right? Because the hospital lobby is strong. The insurance lobby might be the strongest lobby in the entire world. And then you had financial services. And so you had something that was told and taught to people like, hey, we're going to protect your children. We're going to help you get a relationship with your doctor. We're going to give you access. We're going to give you a better plan. We're going to make sure it covers everything and you don't have to pay. And this was like, it was all not true. And, you know, I think for people like me, I'm now 50 and I was 25 in 2000, right? So 35 when it passed. And I think that was the coming of age time. When you're like 32, like you really start not accepting things as they are and you really start asking questions. And I think the ACA really taught me, break down everything deductively, don't think about it politically, and just look for the answers to the questions that people are asking and what happens. So today you've got very much a political battle. This has nothing whatsoever to do with healthcare. It is between the right and the left. And certainly there are nuances both ways, right? Like I could go up and argue for both sides. But at the end of the day, the Democrats want single payer healthcare. They want control over 20% of the GDP. And what people like me fear, right? And I am horribly autonomous. I have so much agency that I couldn't possibly stand to have anybody tell me anything, right? That's just how I'm built. I am a guy from the Netherlands who came to the United States. And right, I know you can identify, which is why I like it. I came to the United States. I then volunteered to be a Marine before I was a citizen. Then I became a citizen. Then I learned English. And I'm like, I don't want to be told anything. And I think the idea of the government telling me, like, we're going to be in charge of your healthcare and you're going to pay us more in taxes, I don't think I could stand that. I think that I would fight to the death before that happened. And that's what I think you and I think there's more people than we know that are also doing the same thing, right? We are literally fighting every day. Like we all have regular jobs and then we're doing podcasts. We're going speaking. In 1 hour, I get on an airplane to go to Kansas and I'm going to all the best towns in Kansas. I'm going to Salina. I'm going to Manhattan, Kansas. I'm going to Wichita, and then I go to Kansas City. So I got a 4-stop tour. By the way, this is all volunteer work. It's not like someone's paying Dutch Rojas to like, hey, here you go. Tell us the truth about the ACA. It's like, no, I'm just here to help you understand it better because you're being lied to and you're being manipulated. I don't think the shutdown is necessarily about Medicaid, but I mean, like it's a whole other problem. You know, these wonderful people in California and Sacramento figured out that their entire budget up until 2019 was coming out of California funds. And then your audience ought to look this up. The matching funds program that they figured out was absolute genius from a financial arbitrage perspective. But what it did was it doubled and tripled the amount of Medicaid enrollees in that state. And they got an extra $4 billion starting in 2019. Not because there were better outcomes, not because they did a better job with physicians, not because the health system was more efficient, not because they did telemedicine, not because of anything creative or actually beneficial to patients. What they figured out, which was genius, by the way, is how to get more money from the federal government using the rules that the federal government has established. And then you say to yourself, people like you and I would say to ourselves, well, is that what the government intended in the first place? Is to completely bankrupt everybody, take as much money as they can from everyone, and then we'll just backdoor in a single payer. Since we couldn't get it done with the ACA, we'll get it done with Medicaid. And every state Medicaid director in this country is using these tactics to get more money. And it's horrendous. And it's bad for taxpayers, period.
Who's getting all the money? The doctors aren't getting the money. The patients aren't getting the money. Is it the hospitals? Where's all the money going?
So I think there's a really important breakdown here. So the breakdown is you've got insurance on one end, and insurance means like, you know, the biggest insurance business is the property and casualty side of the business. So don't think about employee benefits. That's its own thing, right? That has premiums. That's kind of what we concentrate on. But the big cash cow is property and casualty, which is everything from property, work comp, general liability. For you, it's malpractice, right? Med mal. And it includes about 16 items. Well, when you look at those items and you look at how many of those people are self-funded, like we do in employee benefits, it's almost nil. And so what happens is every single commercial brokerage owner who owns buildings, right, pays a premium to an insurance company. You pay med mal premiums to an insurance company, right? And those are expenses to you. But what those companies do is they take all of that money and then every single day they invest it in securities and bonds and they make a return. And then what happens is when you're done paying your premiums and the tails are over, they get to keep that money. And so the market has grown from about $12 trillion pre-ACA to $34 trillion afloat. And the number one company in the reinsurance side of the business is Berkshire Hathaway. And Berkshire Hathaway, as you know, is owned by Warren Buffett, one of the three who agreed to fix healthcare. Well, why would you fix something when your humongous stock price comes from the earnings that your company produces? And so the biggest winner in this whole deal are the insurance businesses. They hold all of the money. So every time an American pays coverage, right, doesn't use it, which most people don't, 90% of people never meet their deductible, much less their max out of pocket. That money just goes to an insurance guy. So they can, 90% of all people in the United States do not use their benefits past their deductible, period.
Wow, that's a huge. And do you know what the average deductible? Well, what's the average premium now? Do you know?
So it just went over $20,000. And if you're a union employee, remember unions, I've helped unions in the past, and I think a lot of them, they do all first dollar coverage, meaning they have no copays, no deductibles, no co-insurance. And so the way that they've done theirs, they're at 28 to 30,000, depending on who you talk to. Like I've talked to people at the UAW, I've talked to people at Steel, I've talked to the candy makers, I've talked to a bunch of different ones. And so they're somewhere in there. But I mean, you start thinking about $20,000 a year. Now, the Republicans have been very good about talking about the federal budget and how much the deficit is crushing us. But I really think the number one problem in America is stealing thousands of dollars from not only working Americans, but also what I would call middle Americans, right? Those making $80,000 to $120,000. They have a normal house, they have 2 car payments, they're both working, and they're just normal families, like trying to do their thing. Their kids are in sports, they're just normal people. And instead of us helping them retire, we're stealing $2,000 a month from them to pay inordinate amounts of money to premium.
Why is it so expensive? Is there no competition amongst the plans that people can shop around and find the best plan? Why does it have to be this expensive?
Well, you and I both know the answer to that question, right? Like, it doesn't have to be this expensive. What's happened is you have places like, and I'm so disappointed. Like, I gave Dr. Oz 9 months now to do something. I was hated on X by my friends who just happen to all be physicians, who said, how do you support somebody like Kennedy? And I was like, well, I like, the food thing's a big problem. And I'm from the Netherlands and we don't have those problems because we don't allow poisonous food. And so I was kind of like this big supporter, right? And now I'm going like, well, the Centers for Medicare and Medicaid have 10 different, let's call them fee schedules just because that's the easiest word to use, or payment systems. And in those 10 fee schedules, there's 4 of them that create a financial arbitrage. And a financial arbitrage just means we're going to pay Dutch $10 for doing something, and we're going to pay Dr. Bowden $1 for doing something. And that's how the nonprofit health systems work. That's how even some of the for-profits work. They're paid somewhere between, the lowest arbitrage is like 168%, but the highest is some egregious number like 12x is the differential for the same work done by a doctor at a hospital or health system, and then they're paid 10 times more. And that is what CMS does. And so people will say, well, how did we get healthcare so expensive? Well, in 2009, we had 74% of physicians who were in independent practice of medicine. And it was beautiful. It was decentralized. Premiums were low. People say they were high. Like, I was around then. I'm like, they weren't high. And then today we have less than 20%. In fact, there's a new study that a physician sent me recently, said that 12% of the total physician population is truly independent. Like, they have no private equity backing. They have no, somebody behind them. Somebody like you, right?
I thought it was, and so it was a lot lower than that. I'm shocked. I'm shocked.
Well, 12%'s like super low. I'm like, oh my God, 12% out of 1,056,000 licensed people is a big number. I just find it fascinating that people are wondering how healthcare got expensive. I'm like, when you take 72 or 73% and you bring it down to 12, and then what happens in every major city, including yours and mine, is the health systems took the double, triple, quadruple payments, and then they went to you and they said, Dr. Bowden, you know what? We're going to give you $5 million. Aren't we amazing? Like, you can come and work for us. We'll give you a W-2. And with $5 million on that 8%, you could retire. And that sounded really good to a lot of doctors. And it sounds good to me. But the story isn't that the health system earned that money. It's that some government bureaucrat decided that health systems ought to get more money for the same work. And so the health systems, they're not dumb. They're smart people. They go, wait a minute, I'm getting $10 and you're getting $1. I can give you millions of dollars for you, doctor, to come work for me. And then within 6 months, I'll make all the money back. And that's how healthcare got expensive. It is significant manipulation. And Dr. Oz, Secretary Kennedy, could fix that very problem tomorrow. There are other challenges that I think you and I agree on that we want solved. Like, I want price transparency. The whole world fights about it. And the feedback I generally get, and I think it's important to get out, is, well, Dutch, I mean, you know, how are poor people going to do this? Or what if I get in a car accident and blah, blah, blah? Okay. Well, here are the stats from the NIH. I mean, straight from the government, right? Again, this is back to like using your brain and thinking. We consume as a nation 18 billion medical treatments and services a year. 15 billion of those or more are laboratory tests under $100. Now, can someone in the United States of America, some fancy pants person, please tell me that Americans can't pick out their own lab tests? Like, you can't pick out a complete metabolic panel, and you can't tell me the difference between, oh, well, it's $7 extra because, you know, we have to inject it. Well, oh, okay, the blood draw can be $7 extra. I don't care. But if some place like a hospital tells me I got to pay $244, Columbia, and then down the street, an independent lab, there's 274,000 independent CLIA labs. What? They'll win the business all day because they'd be like, well, it's $50 here, right? And you go to DPC, direct primary care doctor, and it's like $3. Like, they don't, there's nothing.
Right.
And so I think price transparency is important, not only for patients. Remember, 90% never meet their deductible, much less their max out of pocket. And then you say, okay, well, we effectively have 10 insurance companies. One, that's the giant United Healthcare Group. And then you have 9 others that effectively own the rest of the market. Well, how do we get competition in the marketplace? Well, imagine that if every single thing had a price. Well, people like me who know how to build networks and have made living on building networks for large companies, for small companies, instead of it taking us 6 months, and I'm not nice about it, like, you know, if I have to call somebody like your favorite hospital, Memorial Hermann, because that's what the employer wants in their plan. Oh, yeah, Methodist. I have to argue with these people who are drinking 64-ounce Cokes and going to McDonald's, and I have to argue for 6 months to a year to get a price. Well, that is the largest inhibitor to competition. I want to
stop you for a second.
Yeah, please.
But so they are supposed to have, there is a law that they're required to list their prices on their website.
Yes.
But then they put it in code so that you have to, like, I don't know what, was it JSON, or you have to like translate it.
Well, it's not translatable.
How do they get away with
that?
Like,
I just met with a company that's trying to figure out a bunch of doctoral students. And when I mean doctoral students, I mean like the real nerds. These people are world-class out of St. Louis University, and they're having a hard time. It took them 6 or 7 weeks to begin to break one health system code. Oh, the reason they get away with it is because, you know, I spend a week in DC every month. And over the last 5 or 6 years, I figured it out. Look, lobbyists are fantastic. They know everyone. I've become friends with a bunch of them, like just by being there, and they get everything they want, right? You're a large company. You hire go-getters like the two of us, and you go, hey, go to Washington, D.C. You don't even need to change the law. You need to change the definition of the words. And let's throw it into this bill, like get to know the staffers on all these committees, right? Find favor with the staffers. The staffers make all the decisions. Lawmakers don't do anything.
Yep.
And then all of a sudden you can get a law change, and now, poof, you win. I used to think that it was BS, like somebody was lying to me. And then I started flying out there, and I started learning, and I'm paying attention, and I'm going to meetings, and I'm doing presentations. And eventually you just see, like, it's an entire bought for and paid for system. There is nothing that, and I'm not I'm sure there are some nice lawmakers somewhere. I mean, I've got some friends that are lawmakers, but overwhelmingly, most of them are there to do a job. And the job is, how do I get as much money and power as possible? And I don't give a shit about my constituents. You're probably not allowed to say that, but I don't, people don't care about their constituents. They're just there to screw them over.
Well,
so when people say, why didn't we get price transparency done? Well, we got the law written, but guess what's at the bottom of the law? It says you can put it into any file presentation you want. Well, it doesn't take long for the American Hospital Association to go, hey guys, just do this. And then we'll screw everybody over. I mean, the American hospitals, you talk about a bunch of criminals. Those guys, nothing but criminals. I mean, they're horrendous people. I don't know how you work.
Just a quick recap. Dutch is a leader in the healthcare sector, in independent medicine, transparency, holding people accountable. He spends a great deal of his personal time fighting for the things that we all want. 90% of people do not even meet their deductible. They don't even use their insurance. Where most people are paying, I think you said $22,000 a year on healthcare premiums. It's completely insane. Meanwhile, the hospitals are raking it in. Houston Methodist Hospital, not a day goes by where I'm not assaulted by their brand. Billboards, radio ads, TV ads, swag on, I'm at baseball and some kid has a bag with Houston Methodist Hospital on it. They sponsor the Astros. They sponsor the ballet. I mean, my Lord, where does all that money come from? And from what I understand, there are not a lot of indigent people wandering the halls of Houston Methodist Hospital, yet they don't pay any property taxes. So how is that possible, Dutch? Can you explain that to me?
Isn't it so completely eye-opening though? Like, I don't know what, I sometimes regret going on this journey of learning about how health systems work, but I was getting annoyed. We were building a bunch of ambulatory surgery centers, and that's how I discovered site neutral payments. I was like, wait a minute, the HOPDs, hospital outpatient, they get paid more for the same thing? Like, how does that work? And then, then of course, like most people, right, you kind of get a whiff of something and you're like, well, this isn't right. Well, then what's next? So there are $125 billion of subsidies, and not a fake number. We produced a whole paper on it, white paper on it. There's $125 billion of subsidies that are given to every nonprofit. So there's for-profit health systems and not-for-profit. These are given to the nonprofit health systems day one, January 1st. So in the attempt to say, how do we make the independent practice of medicine, which is for-profit, right? And the government ought to encourage that. You take out your money, Dr. Bowden's money from her family, and you're like, well, I'm going to rent an office space. I'm going to get equipment. I'm going to make sure my license is up to date. I'm going to hire the lawyer so I can be compliant. I'm going to do this plethora of things. Well, the nonprofits, they get it all for free. And that doesn't make much sense, right? So there's kind of 11 structural issues. And by the way, all of these are somewhat new. These all started in the late 90s, early 2000s. So the very first one we got was, you said it, nonprofit health systems, right? All the Democrats are up in arms saying, no one all these billionaires don't pay any tax. And I'm like, well, Kaiser, who's the largest nonprofit health system in the country, made $118 billion last year, 118 billion with a B. And they also own, that's the revenue. And they also own a bunch of real estate, and they also own real estate investment trusts, and they also own like everything else. And then you say, well, they don't pay property taxes. So when they buy a private practice, which they've got a lot of those, then you went from someone who paid property tax to no property taxes. You went from someone who paid state income tax on the revenue to nothing. Someone who paid federal income tax to nothing. And so one, they don't pay taxes. Number two, when they raise money like you and I do, let's say we want to build a surgery center, or let's say we want to build an in-office procedure suite of some type. Well, they get tax-free bond issuance rights. So people like me who went to grad school and studied how to build and create bonds, right, goes to them and says, well, you can do it at a tax-free rate. Call it 2.5%, 3%, whatever the Fed funds rate is. But if I do it as a private practice or representative, I have to go to the bank just like everybody else. And I got to borrow at 8, 9, 10, 12%, depending on my credit rating. And so you have these structural inequalities that are just given to health systems. Then you have things like dish payments, which say, well, like you saw a Medicaid patient, we only paid you $40 to see that Medicaid patient. Since we only paid you $40, we're going to give you an extra $1,000. like completely arbitrary. If you see a Medicaid patient, you just get paid whatever Medicaid reimburses, which is generally very little. So you have dish payments, you have tax-free financing, they don't pay any taxes. Then you have things like the upper payment limit, which also have to do with Medicaid. Then you have, like, let's say student loans. So let's say another doctor, wanted to work with you and was very passionate about the same mission, and you guys share the same requirements. Well, if they go work at a Houston nonprofit health system, they get their loans paid off. But if you see Medicaid patients, because you and I don't discriminate, I'm like, we'll see Medicaid patients, we'll see Medicare patients, we'll see any patients, just because that's what doctors do. Well, but if you work at the nonprofit health system, you get your loans paid off. But if you work at a for-profit practice, you can't get your loans paid off. I mean, like, come on, like, this is absurd. None of this makes any sense. It doesn't make sense to anybody. But again, it goes back to, well, who's lobbying for who, right? I joined this wonderful association called the Physician-Led Healthcare for America Association about 4 or 5 years ago. I became a board member last year. And I have to tell you, like, I see the same 30, 40, 50 doctors in DC every time I go. They're like you and me, and they go up there on their own free will. They're doing their own things. But there's 1,056,000 licensed physicians. Like, where's everybody else? What are they doing? I mean, I've posted it 100 times and said, hey, if everybody gave, I don't know, $500, $1,000, we would have the power to give more and lobby harder than anyone else. But doctors don't like that. They go, I don't want to bribe a system. And I go, well, that's the way the game's played. I'm sorry to deliver the bad news. Pfizer whips out their checkbook and they just buy the members of Congress. That's what it is, unfortunately. You have to do that if that's the game you want to play.
Well, what I discovered during the pandemic is that, doctors are pretty complacent. They're very comfortable in these positions where everything's taken care of. And doctors have turned liberal. I mean, it wasn't always that way, but the whole profession has become very left-leaning. Do you think that's part of the problem?
Look, I certainly think I've kind of grown up with the same doctors. So I think when I was 25, living in New York City, I'm from a very liberal country called the Netherlands, right? It's very liberal. And I think as we grew up, we went from being more liberally minded to being staunch conservatives. I wouldn't even say Republicans. I would say staunch conservatives. And that's just because, like, you get married, you have kids, you start a business, you have to pay for things. Your parents aren't making your car payment anymore. Your parents aren't paying your insurance premiums anymore. You're paying them. And I think when you get to that pragmatic portion of life, I mean, look, I do a podcast with 4 doctors, all who are highly accomplished, and all of them, save for one, live in a very liberal city: Philadelphia, New York City, San Francisco. And they're all staunch conservatives, and they kind of came about it the same way I came about it, which is just life. So I do think when I look at the AMA, the American Medical Association, you have a lot of left, like, this is like beyond left wing. They are progressive nut job crazies, and they're all residents. And I love them all, and I talk to all of them. Yes.
They're indoctrinated.
But they run the AMA. I mean, they're more concerned about climate change than they are about, like, how do we get patients affordable and accessible care? So yeah, I do think there's something to that. I feel like I've been quite pessimistic about everything, but I will say this: innovation and pressure breed solutions. And I look around the country. This year alone, I was checking before I got on camera with you, I've already seen 253 practices in person this year. And as I look around the country, I see all these doctors who are going, like, the pressure's real, and they're finally, like, they're doing things to change it. So, like, to reduce their costs of their own businesses, they're creating coalitions around the country. Like, I push the coalition business, but they're doing the coalition business, right? I'm seeing them say, hey, I know we were told we can't unionize, but what if we create an organization by state? Can we doctors work together and then work against the payers? Turns out when you hire a bunch of lawyers and you pay them a bunch of money, they figure things out and they go, well, yeah. Then it got questioned in the courts, right? Because now the payers are upset. They're going, like, the Blues are like, no, we're suing you. Okay, well, sue us. And then we won. And it's like, well, okay, we won. So now the doctors are going, now you got a whole new group of doctors going, like, hey, can we band with you too? And so I'm also seeing solutions to all the challenges. Like, the incumbents.
So is this helping small practice, individual or small practice doctors compete with the insurance companies? Is that what you're saying, to get better rates?
Yes, so on the payer side, right, negotiating their payer contracts, everybody since, I mean, I got in the business in 97 and I've been told this whole time, you can't collude. You can't, like, you and I can't get together, and you can't get together with some of my docs and we can't. Well, it turns out you can. You just have to do it in a way that's accepted legally. Well, we figured that out. And then we started sharing our advice with doctors online, and we started sharing it with people around the country. And guess what? Turns out you can. So now there's coalitions of 100, 200. I haven't really seen any bigger than 200 independent physicians getting together, 2s, 3s, and 4s, and going, holy smokes, we can do that. And there's always a couple of doctors that are really good at something. And so they kind of rise to the top and they go, hey, you don't even have to pay me. I'll just do it for us. Right. And then all of a sudden, the payers are going, like Blue Cross Blue Shield of Oklahoma, which is really owned by Blue Cross Blue Shield of Illinois, says, oh, I mean, I need these 238 doctors in our network. I guess I have to negotiate with them. And instead of you going to them and saying, like, my outcomes are better and we do better and we're so amazing. No, they call you and they go, can we please have lunch? In fact, if you want to go to dinner, we'll take you to dinner. Country club. I mean, like, the relationship has changed. And so we're seeing that there. We're seeing the same thing with employee benefits. We're seeing the same thing with ASCs. We're seeing the same thing with in-office procedures. And so I don't want to leave the audience thinking like that all is horrible with the world, because I see a world of hopefulness. And I also see a world where the status quo will break, right? People are acting rationally within an irrational system. We have an irrational system, but people act rationally inside. And that system over the next 3 or 4 years will break, because the Medicare, Medicaid budgets can't be sustained. Something has to give. And so whether it's our national debt or whether it's these premiums, something's got to give. And when it gives, it can either give gracefully, and people like us can be used by Washington to create beautiful policy and to kind of create a soft landing. I don't really see that happening. I see more of the same, where it's people that don't know what they're doing and they create a bunch of chaos, and then Americans figure it out for themselves. I think that's largely what will happen. But the private sector is doing a good job. I mean, I'm seeing more employers come to the table and say, tell me more about direct contracting. I didn't realize that deductibles were so hard on my employees. I thought my employees were greedy and, they needed to have some skin in the game. And I'm going like, well, no, when we poll people around the country, more than 80% of respondents, which are usually the wives and the moms in the relationship, because they're in charge of healthcare in the house, they all said, well, I'm too afraid to use my benefits. I don't know what the price is. And we already have a small middle class income. And so if I go to the doctor for myself, not for the kids, if I go to the doctor for myself, I'm afraid it'll hurt our family. And now employers are going,
you get this.
Well, right. And so employers are going like, we can use innovation to get rid of all of this. And they're contracting with people like your office. They're taking the ideas that I had in 2008, 9, and 10, and now they're really using them. And nothing makes me happier than to see that. I get these wonderful emails from moms. And I got one the other day, $3,000 for a general surgery. And she goes, Dutch, I called this company that you told us about, and they got my son in. And I mean, like, I kind of like, I got emotional about it.
Yeah.
And I thought, okay, this is the answer. Like, if we can just do this and we can help people, then we win. But it took 12, 13, 14 years for this to get across. Like, I don't know why it's taken so long. Right? So we have solutions. We know what to do. The government knows what to do. We just got to get the people in line. We got to get the doctors organized. We got to get Americans organized to say, hey, we're not going to take it anymore. This is what we have to do.
Rojas. And, last segment, you were giving us some glimmer of hope. I'm not sure I'm convinced that I'm not very hopeful. I'm still feeling like I'm like the only independent doctor in America, and I'm feeling very overwhelmed. And I know most of my patients are very disgusted with the healthcare system. So tell us some practical ways, some practical things people can do. How do they fight back? What else can they do besides get on Twitter and rant?
Well, that's a really good way to start. I really like, look, everywhere we go, and I mean, you have a gazillion followers. I have a few. The idea is, I wish more physicians would get on social media, right? And really just kind of tell their story. and I really don't care which side of the story it is, but we did something interesting at PHA in Santa Fe. I interviewed 26 different physician-owned hospital owners. And like the information was fantastic. Like they told the story of, hey, I took a year off practice. I didn't know anything about building a hospital. And then 3 years later, we had a fully functioning hospital, right? And so you hear these stories over and over again, and you realize that, and I probably get an unfair look because I'm in a practice. I'm in 3 or 4, like I'm in 4 or 5 practices this week, right? So I just get to meet everybody. And I've been doing this now since 1997. So for a few minutes, not long, but not, a short period of time. And so I have a ton of hope because I feel all of these physicians and their energy, and they're all saying, look, we have real structural problems, but we have solutions. When it comes to patients, right, for the small group patients, I always say, make sure you get an estimate before you go in and see the physician, right? And this is where consumers have to have some real agency in their life because the doctor's office will push back. Not because the doctor's office is evil, because they don't know. And so I walk in with the information from the No Surprises Act and I say, here you go. You have to give me a good faith estimate for this, right? And it has to be within $300, right, of what you've promised. Otherwise, you can't charge more. And now some people go, well, that's not a big deal for an MRI. Well, I know, but it's a big deal. Like I paid cash for delivering our child. I negotiated with Honor Health in Scottsdale and they were wonderful. And they gave me a brilliant price way below insurance. But I also paid 100% of it. And I understand every American can't do that. I 100% understand that, right? So, but the point is, I got a good faith estimate from them, right? And when they sent me the bill, I held them to the bill. And so that's one way. The biggest advice that I can give.
Hold on. Did they try to charge you more, or did you have to negotiate after the fact? Were they honest about it, or was it a big fight?
No, it wasn't even a fight. They sent me a very large bill, and I sent them back their good faith estimate via fax, and they said, "Oh, oopsie, you were right." And so there was no fight. There was no issue. But now that hasn't been the case everywhere. In Tulsa, Oklahoma, Sienna, my daughter had her adenoids out, and they sent me to collections after I paid. And there's a pretty egregious healthcare system here. And so I started getting calls. I'm like, what collections agent? Why are they calling me? It turns out that if you don't pay your bill within 2 months or whatever, they just audit. By the way, this health system in Tulsa owns the collections agency. They own it, right? Which is egregious.
What?
But what happened was, then they told me, oh, well, we put the bill that you paid in your name, not in your daughter's name. And so that was the confusion and we got it wrapped up. But nonetheless, there were still like challenges with it. But the number one thing that I try, because this is the largest segment of people, is when it comes to healthcare delivery, most employees get denied somewhere along the way, right? Like they need a procedure. They need, I'm just going to make one up. They need a knee replacement and they're 47 years old and they're a mother of 3. Well, the United Healthcare, will pick on them because they're easy to pick on, will say no, right? They'll deny it. The number one thing you can do is call your human resources department. 105 million Americans are covered by self-insured benefits. In other words, the company pays cash for everything. And the middleman, in this case, United Healthcare, just make sure that you have a network and they just make sure the bills are paid to the right people. So they're really just a fancy bill paying company. But what happens is when you go to HR and you say, hey, this is a problem and I'm getting denied, you know what HR does not want? Upset employees and conflict. And in 99 out of 100 cases, I've seen the HR person go, we'll get that fixed right away for you. Sometimes they give pushback and I'll say, hey, talk to them again, and then it gets resolved. That is the number one piece of advice. I'm like, get a price, get a good faith estimate. Number 2, always talk to your HR department. If you get denied, call them right away because your boss needs you. There's no jobs apparently. I mean, there's no good employees anymore, so they want you. But also HR doesn't want to disappoint any employees. The people that work in HR are very relationship-oriented people. And so I have seen, and this is an example I'm using for you, I bet you I've seen 10,000 of these instances over the years, and they all get resolved. They go, I got denied 3 times. And I go, just call HR. They'll fix it. And then they do. And so these are just little practical ways that people can solve their problems. Now, if you're in a fully insured plan and you're like me, you're on, one guy plan, well, good luck. you don't have any power. But if you're there, you do. Now, did you ever work with any religious plans? What are those called? Sharing plans. Did you ever work with those?
You mean contract with them?
Yeah.
I contract. Well, I worked with a Texas system, a Texas medical management company.
Oh, yes.
So, well, I don't know if it was. I think they worked with Sedera maybe. But then they started messing with me. They started messing with my prices. They started not paying me. And I'm just like, I don't need that. Well, it was subtle, but it was a creep. And I'm like, I don't need it. I'm plenty busy, and I'm just not going to put up with that. So, and the same, I was working with Coral. I don't know if you've heard of Coral. Yep. They find, and same thing. I wasn't getting paid. So I just stopped, and I don't need them. I word of mouth keeps me going.
I love that. And by the way, oh, go ahead.
Yeah. No, I was just going to wrap up and have tell everybody where they can find you.
You can find me on X and LinkedIn. Like you, I'm not loving LinkedIn lately. Like they're not loving me like they used to, so I don't spend as much time there. Mm-hmm. YouTube really doesn't like me, which is disappointing because I would do. Yeah. But X, Elon, he loves me. I wish he spoke Afrikaans. That way we could communicate a little better, but nonetheless, he's English. So there's none of that. But I love X. I'm always there. You can find me very easily. And I try, like you, I really do engage with most people. We got our metrics back a couple of weeks ago, and they were like, oh, you have 30% engagement. The average account is like less than 1%.
Wow. That's amazing.
Well, I really like the people that tell me to go back to Mexico. I love them the most. The wonderful, loving people on X.
Right.
Yeah.
And then when is your podcast? Where does that air, and when is it on?
It comes out every Thursday on Apple and Spotify and kind of wherever you can find them. This podcast has been a joy. It is so much fun to hang out with 4 ambitious physicians, one of which is employed by the University of California, San Francisco. So it's an absolute hoot to hang out with him. And then you've got 3 kind of mavericks who work in independent practice and do what they do. And the nice thing is everybody argues about the nuance of healthcare. And so I think, I think it's great. And thank you for having me on. This is wonderful.
Yeah, no, this was very informative. I spend most of my time ranting about COVID, so it was nice to veer off into a very different direction, but very important. And we'll definitely have you back again because I think we just scratched the surface. So thanks so much.
All right,
Dutch,
well, it was a pleasure.
And
thank you.
Have fun in Kansas, and we'll see you soon.
Yes, ma'am. Thank you so much.
You bet. Okay, TJ, we're going to wrap up now, and we will see y'all next week, Wednesday. We'll start at 12:30 Central Standard Time every Wednesday. And thank you to the Wellness Company for making this possible. If you're buying supplements, please use them. They're very like-minded. We are very aligned in our mission. If you use the code MARY, you get 10% off. So thanks very much.
On very quickly, just to close out the show, right here on the SJ Network. You can find Dr. Mary Talbot live on the SJ Network every Wednesday, of course, and you can catch my show, The Shannon Joy Show, every day live at noon p.m. Eastern Time. Tomorrow, and this is why I wanted to come back in, wanted to let you all know we just booked the amazing Congressman Thomas Massie live on the SJ Show tomorrow at 12 noon Eastern Time. Speaking of food, speaking of corruption, we now are facing a pretty massive rug pull. Donald Trump now threatening the businesses of so many American ranchers and farmers as he cuts a deal, or apparently seeks to cut a deal with Argentina. This is an absolute disaster. We're going to get the full story tomorrow with Representative Thomas Massie. He's also going to talk about his bill, the Prime Act, which would essentially set ranchers and farmers free. So I wanted to make sure during the show and the interview, that was when we booked Tom Massie for tomorrow. So if you are watching right now, again, the Shannon Joy Show is live every day, Monday through Friday right here on the SJ Network, Rumble, Twitter, Spreely TV, Roku TV, YouTube, Substack, you name it. We also carry, of course, On Call with Dr. Mary Talley Bowden, sponsored by the Wellness Company. So that's exciting news. We will see you tomorrow, next week, another edition of On Call with Dr. Mary Talley Bowden. You guys are amazing. Thank you for your sponsorship and support, and we'll see you tomorrow. There we go. Let's go. That was a long shot, but I'm glad I reached out this morning. So yeah, that'll be that's super, super relevant. And I'm super pumped. He's awesome.